भी ऑन कर ले यार एक। क्या चूक है रिकॉर्डिंग चालू कर ले मैंने। वीडियो मत कर, पीछे से दिखेगा तेरा, मेरा नहीं दिखेगा।
यहाँ पे कोई कैमरा नहीं लगा जानवर से। ऐसे तो मीटिंग लेके तो यहाँ पे करेंगे।
चालू रही हो, मैं तो बंद मत हो रही हूँ।
बीच में बंद होता है क्या?
टच हो गया तो गड़बड़। लाइट बंद करके नहीं, फ्लैश चालू हो रही है। मेरी फ्लैश नहीं दिख रही ना?
नहीं।
तो रिकॉर्डिंग पे है। कौन रखा है? मूवीज डिलीट कर देना थोड़ी, मूवीज डिलीट कर देना थोड़ी। बीच में ये नहीं आएगा ना, बीच में फ्लैश ऑन नहीं हो जाएगी ना तेरी।
पता लगा बंद पड़ा।
बैटरी है?
बैटरी तो है, बैटरी है।
व्हाट्सएप से बैटरी मजबूत डाउन होती है।
सुरेश राव
एक
कौन?
थोड़ा इस पे भड़कते हुए नहीं होता
I'm Dr. Vinay, Dr. Rao, Dr. Joshi, Dr. Karande.
Yes. Kshitij, deceased father, is Amol Kamble, Tilok Tunwal.
Yeah, Tilok.
Okay. I think you guys are known ki why we called up this meeting, right? So I just want to understand one thing. It was a mess from my end. It was a mess done by doctors. Dr. Suresh, I respect, he was nowhere involved because baby was not reached to surgery, right? But I'm considering the famous name of Kokilaben, I was not aware that you have the doctors who can do negligence on their part. We come on third. Dr. Suresh checked baby reports, seen reports only. He was okay and he suggested for surgery. He guided properly, and opposed that. We requested come back on 13th. 13th को हम लोग वापस आए. Dr. Tanuja ने उनका 2D echo भी किया, and baby as per report submitted by her, he was perfect, right? They again suggested कि अगले 2-3 हफ्ते में हम लोग सर्जरी करेंगे. That is the time which is okay. Baby का weight भी सही है, सब कुछ okay है. We'll perform surgery in that period. My brother, was in India, so I thought there was a moral support as well. तो मैंने ब्रदर को कंसल्ट करके वी टुक अपॉइंटमेंट, ठीक है, सर्जरी के लिए हमने एडमिशन के लिए नीचे बोल दिया. एंड 15th was the admission date which was to be baby was to be admitted. But to my surprise, when we come to Kokilaben on 15th, sir secretary was not aware कि आज एडमिशन है. Whereas मेरे को नीचे से एडमिन से कॉल आया कि साहब का एडमिशन है, आप आए हैं कि नहीं. That was the first coordination कहीं पे नहीं थी. That was a goof up. Secondly, we waited for 3-4 hours. अगर वो 3-4 घंटे मेरे बच जाते या फिर एडमिशन, माई पॉइंट इज वो एडमिशन मेरे बोलने पे क्यों हुआ? अगर इट वाज सो कॉम्प्लिकेटेड केस, व्हाई इट वाज नॉट टेकन ऑन प्रायोरिटी? दिस इज माई पॉइंट विच आई नीड टू हाईलाइट. एंड फॉर दिस आई हैव ऑलरेडी इन कंसल्टेशन विद मीडिया, आई एम इन कंसल्टेशन विद यू कैन चेक योर फेसबुक पेजेस, आई पोस्टेड मैनी थिंग्स. And
let's discuss the problem first.
Yeah. So this was the issue why it was not diagnosed. एक दिन में ऐसा नहीं होता है. Baby was perfect at home. इतने दिन वो रहा घर पे. He was very much perfect. Feeding भी लिया, weight gain भी था, सब कुछ था. Whereas जो death certificate पे आपने reason mention किया है, उसके हिसाब से weight gain भी नहीं होता properly. कहीं ना कहीं complications रहती हैं. But baby was okay. So एक दिन में ऐसा क्या हो गया तो एकदम से he was passed away. My point. He was admitted to this NICU. He was shifted to ventilator in 2 hours. And अचानक से ऐसा क्या हो गया that we lost our baby. This was my point. And if it is, see, Dr. Tanuja told me at 6 p.m. that was a blood infection. Around 9 p.m. again it was a blood infection. I was not aware which infection that was. Morning it was a blood infection. If it is a death due to blood infection, then why on death certificate is not mentioned? On death certificate is TGA plus VSD, which is the basic cause जिसके लिए आप लोग ने टाइम दिया था 2 weeks का या 1 week का. तो why this reason was not mentioned on death certificate? So for me it is a purely goof up from hospital side. Seriously. Now your views.
First thing, we start from the beginning.
Okay.
So, death certificate we can explain later. You want to tell him about the situation when the baby came in and the admission was advised.
So I saw the baby on 14th and we have done an echo, and you already had a previous diagnosis of TJVSD. The only point which was of little concern was baby was a little irritable, for which we had to take the baby 2 to 3 times and we had to try feeding inside. So apart from that, there was nothing concerning, there was nothing alarming that the baby was sick or the baby needed urgent admission. The baby was saturating around 75%. The baby was okay. And the baby had taken a feed by the time we spoke.
Okay.
So to press on admission urgently that time did not occur because the baby was fine. But I did suggest to you that when you asked me when would be the best time to admit, we did go through the fact that it is better to admit on the same day.
No. You have asked us to, you have 2 to 3 weeks time. You told us.
Let me finish.
Sure.
Yeah. Then I was asked when is the surgery likely. So that time I had told you that the surgery can wait for a week to 2. Okay. Then you asked me when would be the ideal time. I think your brother asked.
Correct.
When would be the ideal time for admission. So I said, from my side, it is better that you admit him today because he started showing symptoms. Then your mother asked me, what are the symptoms? And I told her that the baby is not feeding as a baby should feed, but the baby is stable. So I am not going to rush or press upon the admission, but it is better that you admit because the baby has been irritable. Then it was decided that you will have a word with Dr. Rao and then you will take a call for admission. After that scene, in the interim, I think you are waiting for Dr. Rao and Dr. Rao has seen you and it was decided that you will come back in a week.
Okay.
The next day, we did not hear from you. The third day, on 15th, I get a call at around 3 o'clock saying that you are waiting for admission. And I asked the secretary that I want to see the baby before you admit. Before that, we had no clue that you are waiting for 4 hours. Nor did the secretary inform us, nor was the secretary informed that you are waiting for 4 hours. When I saw the baby exactly at around 3:30 for the echo, we did the echo report was the same. But the baby looked slightly off color. And that time I told the mother, it is better I'm going to shift the baby to the ICU. I did not consult you because there was no formal consultation. You had come directly for admission and I consulted the mother. I told the mother that we will be shifting you to the ICU for blood tests. So that has been the sequence from my side. After the baby goes in the ICU, it has been seen by the ICU doctors and I have been around.
Okay, first thing, for 4 hours you were not aware that admission is planned. First point. Whereas I am getting calls from my admin department, TPA department, 2 different departments that your admission is booked when you are reaching first goof up, right? Prior to that day, on 13th only, we booked admission and I informed TPA, I submitted all the documents. You can see these all documents on 13th June. I have submitted to your TPA department approval of 4.5 lakhs as per packages taken. Money was not nowhere the issue. The thing is, you guys were not aware that 4 to 5 hours of surgery is planned. It was a surgery, not a bandage.
No, surgery was not planned on that day. Surgery was planned.
Admission was planned for surgery, correct? So it was not a minor wound that is to be, bandage इस पे करनी है कि उसके लिए मैं admission कर रहा हूँ. That was a major surgery where your secretary was well informed. She should be informed from your department only. Whereas I waited for 4 hours. वो 4 घंटे भी मेरे लिए precious थे उस समय पे when this is the case.
Retrospectively speaking, yes, but I mean, at time you had come for surgery, admission for an elective surgery. And they look at upon the availability of the beds and other factors. Money was not an issue there.
But on that day you...
The baby was not doing well, you could have directly gone to the doctor.
No, they were not waiting for bed, it was confirmed. You can see all documentation was done on 13th. It was confirmed that you take the baby, will get him admitted. Then why you guys were waiting for 4 hours for bed?
Availability, they would be checking the availability.
Then how you confirm?
What according to you was the cause of delay?
Cause of delay was miscoordination. There was no coordination between departments.
No, once you go to the admission department only allots the beds.
That's what I'm saying, sir. That's what I'm saying. These all documents were submitted as per guidance from your department only to TPA.
Right.
Budget was approved. This admission, मेरे सपनों में नहीं आएगा ना सर 15 तारीख को एडमिशन है. It was confirmed only and your department called me up कि सर आप कहाँ हैं, एडमिशन है आपका. So why sir secretary was not aware? Why I was waiting for 4 hours with baby?
It has nothing to do with the admission. The
She was.
Can I ask you one
Yes.
question? What was the day of admission given to you?
15th.
Yeah.
15th.
15th of the day of admission.
Correct.
You were called for admission on 15th.
Correct. On 13th we booked it.
Right.
On 15th they called up. You can check your recordings if you can.
Who called it?
From your admission department.
To you?
Yes.
Okay.
When I was in hospital, they called me. Sir, आप कहाँ हैं? आपका admission है आज baby का.
Were you called from home or no? 15th. Why did you come to the hospital?
Because admission was intimated already.
By the
Admission department only.
They called you.
Yeah, we planned for admission and they confirmed us that bed is available, you can come on 15th.
Right.
So we, as per their guidance, we came on 15th and they were inquiring, sir, aap kahan pe hain? Whereas,
The other question which I would
Yeah.
like to know for my this one is, you came not because the child was unwell.
no.
You came because the hospital called you for the
Correct.
admission.
Because as per me, baby was okay. Baby was taking feed properly.
Right.
Weight gain was there. So even if you see the reports from Cure Hospital, where we went for vaccination, and you are well aware of Dr. Srinivas L.
Yes.
Right. So he guided properly on medication. On medication day was Cure में भी doctors experts हैं. उन्होंने भी कुछ ऐसा complexity देखा नहीं and medication दिया properly. सब कुछ proper था.
Right.
Weight gain भी था 2.6, 2.8, 3.2 was the last weight. So we actually was in hurry because my brother was here, my brother-in-law was here. So
That's fine.
Yeah.
I mean, in the sense that you were called on 15th for
Correct,
admission.
for admission.
Surgery thereafter, after
Correct,
the admission.
correct.
Now, thing is, you came at what time to the hospital?
We reach around 11, 15.
11 o'clock.
Yeah,
Right. So you reported to my secretary, or you reported
both. Your department, admission department too, and your secretary. Well,
Also.
yeah.
Right. And did she ask you to go to do the formalities, or what was that?
No, she was
I'm
not.
sorry, I have to ask you.
No,
this.
you
I was
have the
not
right, sir. You have the right. You have
don't know the-
because I want to be very clear, and you
Yeah.
guys, sir, you have to be very clear on part, so you can ask questions. No worries in that. My point was, when we intimated on 15 that we came for admission, she was like, "Sir, admission तो आज है ही नहीं. Admission का तो कुछ खबर ही नहीं है हम लोग को." And we waited for 4 to 5 hours to get. She was.
Because generally, I mean, what we have been doing, if you are given a date of surgery on 15th, either you are expected on 15th, or if there is a postponement due to some reason, sometimes we are flooded with emergencies.
Correct.
You are called to give
Correct.
a fresh
That
date.
is perfectly known to me, sir. That is written on your contract only. This is the contract, and these are the contract pages where it is written in emergency cases you can refuse.
Or maybe I will give you a fresh date, maybe next day
Correct,
or 2 days
correct.
later.
Agreed.
Instead of you.
Agreed.
So you, so at this one, I think you need to see. I mean, in the sense that
Means I purely understand. I purely understand as per your contract that when there is emergency, more emergency than the baby, than the.
Yeah, I mean, emergency is separate.
Correct,
I mean, if
correct.
you have come here because the child is unwell, straight
No.
away we go to the ICU. I mean, there is no second thoughts.
No as such.
Right.
No as such.
So there is, I mean, a sort of a.
Because sir, frankly, being
I think what went amiss is that there was no medical emergency which was reported from their side to Sakshi, and Sakshi must have thought it's an elective admission. So by the time she informed me, it was 3 o'clock. If there was a medical emergency which there was a complaint saying the baby is not doing well, then usually it gets done within half an hour.
Doctor, you confirmed that it was a delay from Sakshi's end.
No, she is not a medical person to take that call per se. I'm not saying that there was delay from Sakshi. What I'm saying that the lag of 4 hours.
Just for our understanding, 11 o'clock you came directly to admission or to Sakshi?
To both, that's what I'm saying.
11 o'clock you went to both.
Yes.
So what did that mean?
My brother confirmed from admission when they called up, and we, my brother-in-law and I was on floor before Sakshi.
Okay.
She was inquiring, आपको भी उन्होंने कॉल किया था उस समय कि एडमिशन के लिए आए हैं. एडमिशन डिपार्टमेंट में ही कंफर्म किया था that we have to arrange bed and all. It was taking so long. Considering the fame of Kokilaben, I was not expecting this. That was a first.
No, I did not get a call at 10.
Sakshi asked us to wait for 3-4 hours to consult with you.
But I was not told that you've been waiting. I was not told that I'm supposed to.
That you actually need to confirm with Sakshi.
Right.
No, but do you actually meet every patient who is come for
So
elective
we have
admission?
made this sort of for our convenience to see the baby first before we go to the wards.
Okay.
Just to see how the baby is doing. Because sometimes in this flat, exactly that.
All of them, they
all
report
of
first
them
to
who
the
are
department to
department.
Sakshi if they call for admission. And depending on where we need to be, sometimes we have taken them straight to ICU, sometimes we have taken them, because ICU not necessarily they require ICU, but sometimes small babies for blood collection and all that, ward may not be a good area, so we do it in ICU and then send them to the ward. So it is sort of flexible where we take them. And this is the first time where they got a call from the admission, and from the.
You can confirm anytime. You must have recordings of that. You can confirm of 15th. Any recording you can take from 11 to 12. They called me up. When I can show later on. I can share the reports where my bill records.
Yeah, that will go.
Okay. So.
The doctor knows first when they come. That should be the point. That the doctor also knows.
No, what I mean, that's a usual norm. I mean, in this particular child, I don't know what was the. They have got families on both the cases.
So my point is, when I was intimating your admission department and your TP on 13th, so they maximum come back to me by 14th, right? Rather than that, I was coming to Kokilaben for admission. They actually called me up. उनको confirm करना चाहिए, and these things which you will investigate now.
Sorry, I didn't get it. I mean,
what I am saying is, जब मैंने admission 13th को book किया है, TPA में department में दिए हैं documents, then actually on that day only or maximum by 14th everyone should be aware कि ऐसा है admission आ रहा है.
So 15th का admission आपको किसने suggest किया था सर ने?
15th को एडमिशन नहीं, सर ने ये बोला था ये वीक में सर्जरी करनी है, और उसके जब एडमिशन होगा उसके नेक्स्ट डे में आप सर्जरी प्लान करेंगे एज पर योर गाइडेंस.
तो 15th का डेट ऐसा एडमिशन के लिए आपको
नहीं बोला था, एंड वो हम लोग ने डिसाइड किया था बिकॉज वी वांट टू गेट इट डन एज अर्ली एज पॉसिबल, बिकॉज देयर वाज नो पॉइंट वाज देयरफॉर डिलेइंग द सर्जरी
बिकॉज योर ब्रदर वाज हियर.
Correct. Because in Mumbai, I'm residing with my mother and my wife only. There's no one. So it was a moral support and physical support was there. So there was no reason to get the surgery delayed. So the initial, goof up was this 4 to 5 hours wasted. Then all this treatment and all.
Treatment part, I think.
I covered that.
Yeah.
I saw the child around 3:30, 4 o'clock. The child came to ICU, and she was concerned, and she accompanied the baby when the baby came to ICU, cardiac ICU. And there the child was breathless, so the breathing was faster. The pulse rate was faster. The baby looked pale. So off color, dusky. So I was a little bit concerned about it. And I thought, what could lead to this happen? So by then the child has been here in the hospital. So maybe a couple of things come to our mind. One is maybe the cardiac condition that the child has, whether it is deteriorated. Because sometimes the hemodynamic change, the pressure change, and this can happen. Whether that is the situation, or the other commonest thing what we think of is dehydration in these babies, which is very, very common because they don't take feeds, they are irritable. And the third thing is infection. So these are the sequence of these are differential diagnosis, what we call it as. So heart disease remains in the background. Along with that, dehydration, which can be acute because the child they may not be feeding well for a couple of days. And the other thing is the infection. So because all this presentation remains the same. The presentation doesn't change. And the newborn babies are very prone for infection because of the natural immune function. So that is the first differential diagnosis in the ICU, for small babies especially. So when we collected the blood, at the same time we put the IV cannula so that we can give fluids. Because the babies definitely look dehydrated at that time. So we give the fluid bolus to the child. We collected the bloods, but necessary bloods which are immediately concerned. And we sent the blood culture thinking that there could be infection. To confirm that, we suspect. It doesn't mean that it will turn out to be infection, but that is the first differential diagnosis. And then we did the blood gas. In that, when we looked at the numbers, we looked at the lactate, which was high. So that was alarming for us. So this lactate could be high because of dehydration, because of the condition the child had, the heart defect, and could be because of infection. And all these factors coming together, they may hamper the blood's oxygen supply to the tissues, and that's why the lactate come out.
Okay.
So that when we saw that, we decided to support the baby in the form of antibiotics, in the form of fluids, in the form of intubation, because the baby was breathing faster. So that was, that's how we manage these babies when we support. So we did that. And the next thing was, in line to that, we started cardiac medication also, because there was a concern because the blood pressure was on the lower side. So we started the cardiac medication for that. And while we did that, we were doing it continuously. Everything was being done, all these things.
Okay, but considering all these points, you were not able to diagnose it on 13th, or when this condition in one day it was deteriorated. On 13th, he was very much fine as per reports.
I saw the child on 15th.
No, I'm asking Dr. Tanuja. As of now.
See that. Okay,
13th, there were no signs that your child was sick, or we would suspect infection, or we would say that you admit right away. The reason I offered you admission that time was just to be on the safer side. Okay. On 15th, when your baby came, as I said, infection was high on the list because your baby was doing fine with that cardiac condition till then. To tell you a specific organism, or to tell you that this is the infection, it takes 48 hours for the blood test to come.
Okay.
To give you the name of the organism. Now we have retrospectively even checked the reports, and that blood culture has not really shown the organism. So sepsis was a differential diagnosis, and unless we confirm it, we cannot really write on a death certificate unless we have a confirmed diagnosis, which would take another 48 hours to come. And that is the reason we cannot tell you this is the cause of sepsis, because the blood for the organism to grow takes 48 hours. And confirmation, in fact, takes 7 days. After 48 hours, it is confirmed after 7 days. So we waited for 7 days, we have gone through the reports again. And the culture has not grown anything alarming of organism.
But you have not stressed on admission, that's what you are saying. And what if मैं उस पे stress नहीं करता 15th के लिए and घर पे ही ऐसा कुछ होता? Because as per me, there was no signs of dehydration, there was nothing. Because Cure's...
What we felt is that maybe since 24 hours the baby was not feeling well. And that could have been the
No, he was.
that was our clinical argument. And I did come back and ask you how many times the baby has taken feed, etc. 13 to press on the fact, especially when both of us have seen, when Dr. Rao has seen, he is much more senior. So to press on the fact that you get admitted on 13th itself, there was nothing alarming except for the fact that the baby is a little irritable, and I would want to observe the feeds. That was the only thing. These babies with TGAs can tilt. They are usually balanced, and they can tilt. Some of them, very rarely, can tilt in their hemodynamics, and that is what we think after we had a discussion, and that is why we have written TGA as a cause rather than sepsis, because it wasn't proven.
See, one thing is, just to go a little more into deeper, when there is a VST associated with teaching, these children, they are more stable. When there is no VST, it becomes an emergency.
Correct.
So with the VST, I mean, when I tell you this, it is a law of statistics. Now, what will happen to a given child, it's impossible for any human to predict. Unless we have infection or the VST becoming extremely small, some ball closing off, and all these are some things which you can't predict, or you can suspect if you do an echo at that particular point of time. So, whenever we have a child with a VST and the child is stable, we sort of see the best possible time to intervene.
Okay.
And we tell you that look, you can wait for a week, maybe 10 days, maybe a month, whatever it is. But also with a caveat, in the interim period, if you find that the child doesn't do this or doesn't feed or weight loss is there, please come early. Now, this is because very rarely we skip. But VST is generally, it is not an emergency unless there is a particular reason for it. And I am speaking to you from about 700 surgeries I have done. of this. It's not just one or two or whatever it is. But now, why it has happened to your baby, I have no explanation for that.
And also the bigger
And I can't,
babies-
and given at the time when I have seen the child, I'm unable to foresee unless there is a fact there which will make me foresee. You know, I mean, in fact, when I was told that the baby has got admitted, we were most concerned and most surprised because it was not one of those cases where. Then the most important thing was whether the child has got a respiratory infection, because that is the commonest reason why children unexpectedly get admitted. Treat them here, they recover, do the surgery, and send them. That's the usual sequence of events. Now, in baby's case, why it is we still don't know the answer for sure. And the way the child has behaved, I mean, in the sense that usually once you intubate, you put them on the ventilator, they settle down and they give us time to stabilize. In fact, when I spoke to you, I think that night in the ICU, when I came out of the operating room, I was pretty positive that normally we have seen these children the moment they are ventilated, so we got the whole thing ready. Either that same night or next day morning as a first list. But only caveat was to take up the case for surgery, which is a very, very major undertaking. We need certain amount of stability. That's all. Otherwise, we were prepared to just move in.
Correct.
So, the two questions we are unable to answer is what has made the child deteriorate so suddenly? It's not the heart lesion really, number one. And number two is who called you on 15th? It's my mistake. I'll have to check up this.
That will have because
Yes,
since
you
he is
can-
going to operate, he will give a date.
Because
as per
generally
his
I
surgery.
know the admissions coming in that day.
Correct.
Because various reasons. Because you may get admitted, I'm stuck in the theatre, I may not see you that night. It's not right.
Right.
You got admitted and I'm not seeing you. You know. So I usually get the information this one. But in my calendar, I was always expecting you maybe around 20th or 19th or 20th. You know.
In fact, your brothers may mention that in the absence of proper and accurate guidance, the parents took the words of both doctors and returned to the hospital on 15th. That means the date of at hospital admission was not as per this. I mean, there was a little ambiguity about the date. of
That's what I'm
admission.
saying. Your admission department confirmed when they called me up. So it was a confirmation call that you are coming or not.
If he is not, I'll check the
You check,
department's
you check.
communication.
Or else I will-
If he has not written for 15th admission, probably one of you would
I
have
don't think I
approached the
have a
admission
date of
department.
admission in my note. I have not written a date of admission in my
Correct.
note. You know.
So Dr. Tanuja, you consulted with us on 13th and we asked कि मेरे हिसाब से baby blue होता है जब वो रोता है तब when he cries and he turns blue, then your wordings were आपके हिसाब से blue होता है but he is very much blue. हमारे experience के हिसाब से he has already turned blue. When this was the case, when he was turning blue and he was already blue, then why immediate step was not taken? Because turning blue is, you know.
So when I asked you, do you feel the baby is blue? And you said that.
One thing more, sorry to interrupt.
Sorry.
We consulted with you and you assured the surgery can be done on a week or two post that. When my brother asked you कितना जल्दी कर सकते हैं, then you were saying कि immediately. There was a contradiction.
Right.
एक हफ्ते 2 हफ्ते and the second statement was immediately.
Right.
So why?
So when you asked me कितना जल्दी कर सकते हैं, I took it as what is the earliest that we can go in and do a surgery.
That's why we come on 15th.
Yeah. So let me finish. So the question was, how early can the surgery be done? Right. So the surgery can be done even on a 1-day-old baby. The surgery can be done even on a 2-week-old baby. The surgery can be done even on a 6-week-old baby. But the question was, when is the ideal time for surgery? So the ideal time for surgery could be stretched up to another week. But when it can be done, it can be. I still stand by the fact that it could be done immediately, even on the same day, if the baby demands. So if the baby deteriorates, or if the baby is having some symptoms, we go in without waiting. So that was the whole concept.
This was your diagram which you showed us. Post this only we considered, considering complications, we asked you कितना जल्दी कर सकते हैं, then you told us immediately.
Right.
And उससे पहले आप बोल रहे थे कि 1-2 हफ्ता वेट कर सकते हैं.
So
That is my question.
So these are-
Post this we asked you कितना जल्दी, आपने बोला immediately.
let me finish.
Yes.
So these are the answers to the questions put to me by the parents.
Correct.
Right? How soon can the surgery be done? The surgery can be done as soon as possible if the baby demands. That was my reply. Okay? If the baby gets sick, if the baby is showing any signs of instability, it can be done immediately.
No, these were actually not your wordings. Your wordings were as soon as possible you can do.
No, exactly. That is what she's saying, that the surgery can be done. When can earliest can be done? It can be done earliest tomorrow, day of tomorrow, as fast. What is the ideal time to do the surgery? 4 to 5 weeks after birth.
Because the
That
baby
is
is
what she's
stable.
told. So 1 week later.
And
It's the
it is
ideal
confirmed
time.
by the surgeon. It is not just my words. These are
Okay.
medical literature. This is statistics. When can the surgery be waited till? It can be waited in a case of TJVSD for 4 to 6 weeks. And I believe if there was any contradiction in our clinical assessment, even he felt the baby was stable, even he felt the baby could be waited till a week, then it was allowing. Okay, if I am saying no, get it done right now, and he was saying that we wait for a week, then it was allowed. But your baby was stable at that point. It is very, very impossible for us to foresee that your baby is going to be so sick after 48 hours because this region doesn't explain that.
So admission department is not consulting with you doctors before confirming admission?
They usually report to the secretary, I believe.
Generally, admission department don't talk to us. It is our secretary who talks to the admission department. Because the reason is, our point of contact with the admission is
That correct,
the
Dr.
secretary staff. In the sense that they do it. I have got calls from the admission department say midnight someone comes, so and so has reported, and generally in those cases we give the benefit of doubt. If someone has come for admission, I can't recollect every possible case, but we admit them, either wherever bed is available. But generally, the admission department is in touch with the secretarial staff because they are the ones who keep on a daily basis exchanging notes.
So your secretaries are consulting with you whether
Yeah,
to...
absolutely. In the sense that on this particular day, whether to admit or not, maybe she may not have been able to reach me because I'm in the this one. But generally, one of the cardiologists, because we sit in the same area, we work as the same department. So if I'm not available, either my colleagues or she consults there, and then does whatever is necessary.
So that is my point, sir. साक्षी ने आपसे कंसल्ट करने के बाद, बिकॉज एडमिशन टीम जो है उन्होंने साक्षी से कंसल्ट किया होगा, है ना? साक्षी ने मे बी आपसे कंसल्ट किया और यू वर नॉट रीचेबल एट दैट टाइम. Then basis this.
Even if I'm theatre, if I'm in a theatre, if there is a case of this sort, in the sense that needing admission for not routine surgery, but as an emergency or whatever it is, I get the message through my anesthesiologist. I may not be able to pick up the phone, but I do get a message. But here, there seems to be a disconnect. One, you have come here for admission with a child who appeared to be stable on our summons of admission, and you have contacted my secretary. Now, I don't know whether she is expecting you as an admission on that day, and why you have got a phone call for admissions.
So because probably they must have submitted the papers for TPA.
I don't know.
And the date was not fixed. Right. So he has not suggested a date of admission. And
Correct.
in meantime you thought you would process the papers, the TPA, everything. And then on 15th you contacted them for admission.
On 13th only.
Right?
On 13th.
13th for TPA. You must have given.
On 13th we visited both departments, TPA and admission. Admission people guide to submit all the papers to TPA to take prior
So that
approvals.
was on 13th you were not
And
going
you
to
got
get
a
admission.
clearance when from the TPA?
On very same day or maybe next day morning. I was in touch with you have Bharti at counter in TPA. I was in touch with her and she was in touch with my TPA. And I got call also from your TPA that अपने HR से बात कीजिए फटाफट इसको कराने के लिए to release the package amount and all. सो एडमिशन डिपार्टमेंट पे ही बात हुई एंड उन्होंने बेड भी कंफर्म किया. आई थिंक उन्होंने साक्षी को कॉल भी किया था, यू हैव टू चेक ऑल द रिकॉर्ड्स, कॉल रिकॉर्ड्स. उसके बाद ही ये सब हुआ. अदरवाइज व्हेन डॉक्टर्स आर सेइंग सर्जरी इज नॉट सो इम्पॉर्टेंट, देन 15 को आने का कुछ था ही नहीं. मैडम ने जब बोला बेबी वॉज टर्निंग ब्लू, देन मेरे लिए ब्लूइशनेस इज, आप लोग के लिए मे बी नॉट दैट सीरियस, फॉर मी ब्लूइशनेस इज समथिंग एक्सट्रीम फॉर माई बेबी, राइट. सो ऑन दैट बेसिस ओनली वी टुक बेबी ऑन 15. इमीडिएटली मैं एडमिशन पे 13th को बात भी कर, 13th को हम लोग जब आए हैं मैडम एंड सर से बात हुई है, वी प्लान दिस कि 15th को हम लोग एडमिट करेंगे. 15th को एडमिशन, 13th को ही एडमिशन डिपार्टमेंट में बात हुई, उन्होंने बुक किया कि 15th को आप आ जाइए. 15th एट अराउंड 11 to 11:30 आई रिसीव्ड कॉल. आई शेयर माई फोन कॉल रिकॉर्ड्स इफ रिक्वायर. दे कॉल्ड मी, सर आप कहाँ पे हैं, आपका एडमिशन है ना आज. देन एट दैट टाइम आई वॉज विद साक्षी. हम मेरा मेल भी पढ़ेंगे, उसमें भी ये पॉइंट लिखा है कि एडमिशन डिपार्टमेंट ने मुझे कॉल किया बट साक्षी वॉज नॉट अवेयर कि एडमिशन है.
I don't know if the admissions are called on the basis of the date.
Exactly. Yeah, that's what is my feeling.
My
Also,
feeling
because
is
15th date was not actually decided with the doctor. As far as I think,
Correct.
you took a call that on 15th you will admit.
Correct.
And because he is most of the time of the day he is in the OT, so this communication sometimes he may not receive. But if it was written by him on 15, definitely the patient would have gone directly. This was on the basis of TPA processing and your request that we will get admitted on 15. They directly gave you a call.
So now the sequence was, I go to your this admission department for getting the appointment. They called up Sakshi or someone to confirm. ठीक है. उसके बाद उन्होंने बेड कंफर्म किया. यू चेक द स्टेटमेंट व्हेन समवन गोज फॉर एडमिशन डिपार्टमेंट, दे यूजुअली से कि सर आप अभी कंफर्म कर दीजिए तभी बेड मिल पाएगा, अदरवाइज नहीं मिल पाएगा. सो आई डिड दैट ऑन 13th कि 15th को हम लोग आएंगे, यू कंफर्म, एंड कंफर्मेशन वाज गिवन बाय एडमिशन. उन्होंने बोला भी कि आपके टीपीए के पेपर सबमिट कर दीजिए, यू कैन टेक द काउंटर स्लिप्स जो आपकी निकलती हैं उसका रिकॉर्ड भी. उसके बाद मैंने टीपीए का काउंटर स्लिप लिया एंड सबमिटेड ऑल द डॉक्यूमेंट्स. सो फॉर इनिशियली इट वाज कंफर्म्ड बाय योर एडमिशन डिपार्टमेंट to submit all the claim papers day prior ताकि आपका क्लियरेंस जल्दी मिल जाए. So we did that. We submitted all the documents to TPA.
What happens is whenever there is a planned admission or planned surgery, we generally process the TPA papers much in advance. Or so on the day of admission, if we process the papers, TPA papers, and in the evening after the admission, there is the TPA does not allow that admission, then there is a problem. Instead, what we do is 1-2 days prior only we even 1 month prior also we sometimes take TPA.
सर मैं वही बोल रहा हूँ, TPA मेरा second step था.
And this admission doesn't exactly
TPA was my second step for submission of document. First step was admission, which doctor is saying they are consulting with Sakshi, and post doctor's consultation admission is given.
If Sakshi has given you the admission date, if my secretary has given one, she would have informed me. Number two, we would have kept it better free. Normally, in the normal. And the other thing is, in this particular case, in this particular child, we would have taken in the ICU because we don't keep transposition VSDs in a 1-month-old baby or in the ward. So, the fact that we were not expecting your admission on 15th, myself, cardiology and my secretary included. So we were taken aback when you came on the 15th. So we thought the child must have been sick or whatever. That's the reason you have come.
No, that's what I'm saying.
That is where the thing is, because normally if a child of this child comes for admission, they are immediately seen and we drive them to the ICU. We don't take them in the ward. Transposition VSDs 1-month-olds are not taken in the ward.
So child was absolutely fine. Why we took him to hospital was to get surgery as soon as possible to overcome that problem.
That is fine.
Right, because child was very much perfect.
No, perfectly. I mean, we do.
And when you as a surgeon and doctor is consulting and saying that 1 week or 2 weeks is the time we can do, so why I should hurry?
That's perfectly okay. I mean, I'm not. We are not disputing that fact at all. It's because you have got your family issues and you want to get them earlier. And from our side also, things were okay. So we would have certainly accommodated you. But my one is this discrepancy is why we were not expecting. Otherwise, ICU bed is always kept ready for the child.
Here, we have to create a bed.
Huh?
We have to create a bed because we are not aware of the admission.
We have to even shift
The other way, we shift the baby from other ICU. So we have to do the bed arrangements because we are not aware of.
Lactate is basically what? Blood infection kind of?
Acid.
It's an acid.
It's a metabolite. Like lactate is a metabolite which is normal and indicates to us that something is abnormal. Maybe with the circulatory system, with the metabolic system, or whatever.
Mhm.
And it's a sign that the child is seriously sick if the lactates are high.
Normally there is a
ये टेस्ट इनिशियली नहीं करते हैं व्हेन वी आर कंसल्टिंग बिकॉज एक दिन में ये सब होना
No, see, to get a lactate level, you have to do an arterial puncture. And it's not, you can't do an arterial puncture in a 1 month old in the OPD, and it has to be done in the ICU in a controlled setting to get the sample. When you put the lines
It is indicated and then we do that.
That's what I'm saying. जब when as per doctor baby was already blue, and why immediate action was not taken? Why I was pressing button for admission? Why you doctors are not coming कि admission करना है? And एक दिन में सर इतना infection नहीं होता था that baby passed away. एक दिन में वैसा नहीं होता है. When baby was at home for 22 days, एक दिन में I cannot imagine कि इतना बड़ा infection हो जाएगा that he passed away. So ideally it should be diagnosed on 13th, on 15th. 13th को ही आप वो चीज़ अगर when baby was blue, so that was alarming. मतलब when something is going wrong, then that was alarming. I mean, all tests were to be done at that point only. अगर वैसा था तो, because as per me, मेरे को उतनी knowledge नहीं है. What doctor is saying on that basis, we look each and every call. So when baby was already blue as per Dr Tanuja, then उसी समय वो चीज़ करनी चाहिए थी. Because in a day इतना major infection मैंने नहीं देखा है कि सर्जरी टेबल तक ही नहीं जा पाया वो.
See, Mr. Saxena, in hindsight, become wise in life. But at a given situation, we see transposition VSTs with various degrees of saturation, at least about 3 or 4 cases a week. Now, given the age of the child, given the problems of the child, we can't be doing lactates for every child. It's an invasive procedure. That's why we go by what we feel from examination, maybe in X-ray, maybe in echo, which is non-invasive in this child to get the situation. And if we have a feeling that the child is sick, we are not here not to admit the child. Please remember one thing, we are here only for the child's well-being. We don't want to harm the child.
That's why I took him here, sir.
No. I'm just trying to tell you. And we are also humans. We are not gods. Human failings are there with us also. I'll admit you straight. But in hindsight, yes, and that is also a learning in medicine. But what we can at that particular point we can know is what has been our experience, what has been done, what we need to do, because we know getting an arterial sample, arterial line in a small baby, what are the things. We fully understand the loss which you feel. It's not that we also feel a loss. But I think there are circumstances, being humans, we are unable to foresee. I don't know by 2 o'clock in the afternoon whether I'll be alive or not. I don't know that. So, I mean, that is life. So, I mean, in hindsight, yes, we also will feel maybe did we miss anything? Maybe we also ask these questions.
We pondered over this case many times. We were trying to find out what we can change, what we could have done differently. But I think the two cardiologists and the senior most cardiac surgeon, when they feel that the child is so stable, so if you wait, say the child is more stable because the child is growing. Bigger the child, outcomes are better. The ICU course is easier. So with that hindsight, and it's easy with VSD. The intact septum, I think there was no they would have thought directly child would have got admitted and the surgery next day. But here, looking at that, I think that was, all the decisions were taken in the best interest of the child.
What is surprising me, he was very much perfect at home, and getting into ICU, then ventilator, he passed away. 22 days he spent with us at home, and 2 दिन में वो hospital में आके he passed away. The hospital I consider Kokilaben topmost hospital, and यहाँ पे आके तो और अच्छा होना चाहिए था. And moreover, I called up many times. I shared the screenshots of telephone calls which I made to your this TPA department. No one answered. This was around 8-9 calls. More than that, I attached all the screenshots. Nobody answered the call.
What time?
You can check my mails. You can check my mails. You have all the Shahi is having all the screenshots. No one bothered to call me back. No one bothered to answer. This was surprising for me that such a big hospital is doing these kind of good jobs.
अगर सर ब्लड इन्फेक्शन होना ही था तो घर पे ही होना चाहिए था. अगर ब्लड इन्फेक्शन अगर होना ही था तो घर पे ही होना चाहिए था, क्योंकि घर पे
नहीं, हम इन्फेक्शन की बात कर रहे हैं अपने घर पे. सी हम इन्फेक्शन सोचते हैं और ट्रीटमेंट भी देते हैं. इफ यू सी हम इट वाज इन द हाइंडसाइट, इन्फेक्शन मस्ट हैव टिल्टेड द थिंग एंड वी स्टार्टेड द एंटीबायोटिक्स. इट्स नॉट दैट वी वेटेड. We have given the antibiotics, we started the therapy. We didn't wait.
And later on in midnight around, he was on ice pads. I know the reason he was on ice pads. Initially, I tell you very frankly, at 6 around, the first heart stop was there. Nurse was running. She was calling some doctor and she said, today's admission crashed. This was the language which I don't know. For me, it's a death. She called some doctor and she said, जो एडमिशन आज हुआ इनिशियली जो आज हुआ ही क्रैश्ड. सो दैट वाज सरप्राइजिंग एंड मैंने उसी समय भाई को बोला वो नहीं है शायद. सो व्हाट वाज दैट?
I don't know whom she called, but whenever this kind of thing happens, like whenever the child's heart rate goes down and the child becomes, the condition deteriorates.
So what do you mean by exactly crashed?
Crash become extremely serious.
Extremely serious.
Okay.
It's a code like that. And that's the medical language that we use. The baby crash. Yeah, the baby crash.
I mean, now a stable baby suddenly becomes unstable.
Becomes sick or unstable. So that was the wording, and then probably that was she was trying to convey to the doctor.
So why he was keeping on ice pads later on?
You see, now there is it's a medical therapy. Whenever suppose for some reason baby becomes sick, heart rate stops and we revive the baby. Right? So whenever we do this is called as resuscitation, cardiopulmonary resuscitation. Because during all this period we try to maintain the blood pressure and the oxygen supply to the various organs.
Okay.
So and we still feel that there must be some kind of lack of oxygen to the various organs, especially the brain. So to keep the brain intact, to minimize the injury if at all it has happened, so we put the ice packs. So that's the standard therapy.
Okay. 20 minutes later he was on heater. He was on heater.
No, heater we keep it. That we have to maintain that we don't want to either cool the temperature too much. So we have to maintain that balance. So we keep make sure that he doesn't become too cool, he doesn't become hot. So we have to maintain that 35 degrees temperature, especially around the brain, and we at the same time we monitor the temperature continuously. It's for that reason. So it's a proven medical therapy, especially in the newborn.
So therapies and all were okay as per you doctors knows it better, but for me, baby should have treated on 13th or maximum by 14th if this is the case. My point, I'll stick to that point. If baby was blue as per Dr Tanuja, the immediate action was to be taken. And the contradictory statement, the 1 or 2 weeks and then immediately, I'll take it this to media. I am frankly saying, seriously I'm saying.
See, you are entitled to your opinion, we are entitled to our opinion.
Correct.
And you can escalate, you are free to do whatever you want. But as far as the medical treatment is concerned, we are absolutely sure we have done in the best interest of the child.
No sir. I still have respect for you,
No,
but
we have got mutual respect.
Correct.
I'm not saying
it was Dr Tanuja, it was a blunder from your end. Seriously I'm saying. It was actually a blunder from your end. Baby was to be treated on 13th or maximum by 14th. Yes.
See, a TJ-VSD child is expected to be blue. Now, there are levels of saturation over which we act. If this saturation was less than 60, I would have pressed the button. If you think I have made a blunder, your child was seen again by a senior surgeon. So especially this being a surgical condition, he is much better experienced doctor than me. If you think I made a blunder in a span of half an hour, when I saw and then Dr. Rao saw, there would have been a huge discrepancy. Even he did not feel the need to press the button that time. I understand I was your first point of contact. I also understand I have been the face with whom I have been talking to, because I was giving you the updates every hour. And that's why I understand that you have certain questions which are unsolved. Okay? But from my side, I do not see a blunder, firstly. Secondly, your child is saturating 75, which is expected for a TJ-VST. If the saturation was really low, like 50, 55, 60, I would have pressed the button. I would have, in fact, called Dr. Rao to see your child early.
That's what I'm saying. There was a discrepancy. You were saying the surgery to be done as soon as possible. And doctor was saying
I think
this.
that point has already been discussed. Surgery, when you asked them how early can we do?
Can it be
That
done
is
early?
when
Yes, it can be
she
done
said
early.
that,
But is
yes.
the need now?
It can be and it is to be. There is vast difference.
It can be.
My question was, when can be done? You said it is as soon as possible.
Earliest can it be done? That is what you
Her point
asked and
was,
she said,
it can be done
even
as soon as
tomorrow, day
possible.
after tomorrow.
लेकिन ये immediate होने की है ना surgery.
नहीं ऐसा नहीं है as per their experience and their literature 4 to 6 weeks is the ideal time for the baby for a stable baby to operate
infection ज़्यादा हुआ.
infection आप पकड़ के मत
Infection was
लीजिए
second in the
infection
diagnosis.
ज़्यादा बढ़ गया ना blood में इसका
नहीं
Infection is second in the diagnosis, and to prove that we have sent blood cultures which have not shown the organism. So we still believe that it was a heart
So death was
condition
actually
that
not due
filtered-
to this TGA plus VST.
No. We thought when you came on 15 that maybe infection has tilted your baby, and that is what I have spoken to you, that we
See,
have to rule out
this is
sepsis.
the consensus guidelines in Indian practice by Indian Academy of Pediatrics.
Okay.
This is a meeting by all the specialist cardiologists, surgeons of this country. 2008, we have evolved these guidelines. Transposition BSD, arterial switch operation by 3 months of age. That means we don't wait longer than that. Now, in between that, depending on the child's condition, we recommend the surgery. But we don't definitely not go beyond 3 months of age.
Okay.
Because of certain.
So that's what I'm saying, asking, sir. This death was not due to basically TGA plus VST.
It is not due to, it is TJ-VST is the bottom line condition. Now, what has triggered the death due to this superimposed cause is what I think we have seen in this child. Now, the superimposed cause can be infection, can be dehydration, can be change in the anatomy in the heart, which we may not anticipate.
So this heart, this
Or
cause of
the
death is.
or the fact is the child, maybe fever also. For some reason, the child has got temperature. I mean, these are all the things which comes to our mind when you see a child presenting this fashion.
The cause of death here is mentioned as this TGA plus VST.
That is the bottom. That is the basal condition. When we don't know the cause, I can't put infection when I can't have proof for infection. I have to have a culture, I have to have a WBC count, I have to have a CRT and all this.
So now, as of now, you are aware. मतलब कितने दिन हो गए हैं तो आपको अब reason पता है क्यों हुआ था? Blood reports आ गई होंगी and all.
Still, the pattern of deterioration of the child's condition, I don't know. Others I will come and I will told you. I still don't know why he is deteriorated in a span of this few hours. Because morning when you came, the child looked apparently okay. You have come for an elective admission. And the evening, the child is requiring ICU treatment and ventilation. Now, I really can't explain what has gone on. I mean, from the reports which
So whatever reports we got, the blood culture reports,
and we were also after admission in the child ICU, we were in fact there was a period of stability, and we were seriously debating whether we should take up the child till the lactate report scheme. But when the lactates were some 9, 10, and it's on the upward side, we thought let the child stabilize. And And he was okay till I think the earlier hours of the morning.
So reason of death is still a mystery. Means.
That's why we attribute it to the basic cardiac condition, because a normal child usually with a normal heart will either have added dehydration or fever or.
You mentioned it, but that was not a basic reason for death.
No, I don't think so. In hindsight, I mean the sense that because we have got all the reports.
So infection and
But that's
dehydration
why
will be corrected.
we call this a differential diagnosis. Means when you don't know, you treat this, which are the possibilities, and then because in an emergency time, our first priority is to stabilize the child, whatever is the cause. So we give antibiotics if it is infection. We give fluids if the child is in dehydration, or we increase the oxygen levels if we can. We start prostaglandin if required in a child to stabilize the circulation. So all the things are done in one go, but then if the cause reveals, it is okay.
So as of now, अभी पता ही नहीं है blood infection था कि नहीं था.
नहीं, blood infection
नहीं था.
There is no blood infection.
She told us 3 times blood infection से हुआ है.
सस्पेक्टेड था, अभी वो रिपोर्ट्स देखने के बाद आपको
See, that is the first. If you ask me,
Sir, when you are interacting with some parents or someone, your statement should be very clear. Her statement was, this is due to blood infection. 15 minutes later on that, she called me up, she told me this is due to blood infection. If the statement was, we suspect is a blood infection, आपको बताएंगे, then मेरा scenario कुछ और होता. Whereas I mentioned in mail 3 times, जब तक उसकी heartbeat nil हुई है, she was like blood infection. That's why I written blood infection था, तो यहाँ क्यों नहीं लिखा है? Her statement was concrete blood infection.
At that time, I did think it was sepsis. This is my confession to you right now in front of everybody. This is because TJ-VSD should not have deteriorated so fast. And sepsis is the first thing.
Even we thought it's not that.
And this is not just mine. This is how ICU you.
That's what I'm saying, ma'am. When you are interacting, your statement should be very clear.
So that
ऐसा कुछ होता तो मैं उस समय समझ लेता, but
no. But that time I did believe it was.
Because everyone on Facebook, you see, check my this post. Everyone is asking her blood infection एक दिन में. Even doctors are asking blood. क्यूरे में मैंने reports दिखाई हैं, श्रीनिवास को दिखाई हैं.
Now this is hindsight for me. Okay, then the blood culture is negative, so I can say if the blood culture report I did not have, I would have still kept sepsis.
My question is, you were having those reports with you at that time?
No. Blood culture comes.
That's what I'm saying. Your statement would be, we are suspecting this as blood infection.
I understand.
Let the reports come, we will confirm. But her statement 3 times, sir, 3 times. She called me up 6 p.m.
See, this is as a doctor. See, if I put myself in her.
And sorry to interrupt, my brother asked me which infection. She was like, this is infection. जो भी enzymes होते हैं, chromosomes होते हैं, you are not having knowledge of that. So
no, I never put that.
I can take on my brother on video call.
See, I don't want to argue, but I will. The parents who understand TJ-VSD, I will never say that you will not understand.
Brother's simple question was which infection? You said blood infection,
Right.
and in depth you told us that enzymes and chromosomes. You must be not
you
having knowledge of
what are
that.
lactates. I tell you the statement. You asked me what are lactates. I told you that these are levels which we do when a baby gets sick, and I'll explain to you the details of it later. As of now, I want to be with the baby. That was my statement. I never said enzymes.
For me actually, I was. मेरे से कईयों ने पूछा डॉक्टर सुरेश राव के पास ऐसा हुआ, मतलब उन तक तो बात ही नहीं गई है.
I understand. From
सर्जरी
your
टेबल
side-
पे होता है, वॉज ऑफ द ओपिनियन की ठीक है, सक्सेसफुल होना या नॉट सक्सेसफुल वो एक थिंग है, तो ऐसा लिखा होगा, बट टेबल तक ही नहीं पहुंचा. एंड ऑल दिस थिंग्स, ब्लड इन्फेक्शन 3 times, इट इज ड्यू टू ब्लड इन्फेक्शन, whereas you were not having reports.
But at that time we did feel so, and we did treat it. We sent the reports for the infection. That time we were 90% suspecting an infection, and that is the reason I counseled for it.
The counseling was not up to mark actually. Nothing more to discuss from my end. I'll take it further nowadays. Dr. Suresh, I still having respect for you. The case अगर आप तक पहुंचा होता और कुछ होता तो भी मैं समझ लेता कि होता है, मतलब लाइफ और डेथ इट इज विद गॉड. बट वो टेबल तक नहीं पहुंचा एंड उसके पहले ही ये सब हो गया विद इन अ डे. इससे अच्छा तो मैं घर पे रखता, कोकिलाबेन में लाता ही नहीं. मैं जुपिटर नहीं गया था, डॉक्टर श्रीनिवास ने अच्छे से गाइड किया, ही इज कार्डिक कंसल्टेंट, उन्होंने गाइड किया, डॉक्टर संतोष ने, आशुतोष सिंह ने भी गाइड किया, एंड वी सर्च्ड ऑन नेट, वी फाउंड कोकिलाबेन वाज द बेस्ट, बट इट इज नॉट एक्चुअली. ठीक है, I will be requiring revert on this. I will be resending mail on this. One thing, the goofer from Sakshi, that 4-5 hours was actually precious for me. उस समय एडमिशन होता.
We will investigate in that. That is what you feel.
You should have done. I have marked it much earlier.
This discussion, we called you for the discussion immediately after we received your mail. This time was taken because you must be busy with some formalities at home. So now that this has happened in detail, the whole whatever you're saying as a goofer, let us have some time for investigation.
You check your call records from admission department. I'll be sharing my call records, the received ones. Okay. So when can I expect the reward on this?
As soon as possible.
And the second one, the calls which I made to your department, why those were not answered?
That is it. These are busy departments. So people.
So why you're mentioning on site that on emergency you can call on these numbers? I took that number from call center for direct access. Nobody bothered. It was 8 to 9 calls from one number, 8 to 9 calls from other number. So much busy department. I am in service industry. When we are not entertaining customer, there's nothing. Sorry to say. And you are so much busy that you don't have time for your clients or customers. Stop your services then. I don't have regrets on this point from doctors, from the service manager who is dealing with these departments. It's worst. When you can't attend calls.
We'll look at it.
I've already submitted. I expect a reward on this.
No. As soon as possible.
Thank you so much.